Morning, everyone.
Good morning. Great to see everybody. Eloisa, how are we doing? How many people do we have on so far?
We have, oh, well, wait a minute. More people are coming in. Panel members. We're up to 37.
All right. Awesome. Awesome. I see a lot of familiar faces popping on. We're so happy you all are here. I'm going to give it another minute or two for people to hop on. For those of you in Connecticut, which is most of you, what a glorious day it is today. I hope you get outside at some point. We're so fortunate at this time of year to have this kind of, it's like September.
Okay, we're up to 41. If you wanted to wait another 30
Okay.
seconds or a minute, whatever works.
Well, I think we'll start. I mean, I'm really here to welcome you all. We're so happy you're here. This is our final work group session for the panel members, sort of the end of the educational part of this work. And it's been a lot. I know we've talked to many of you individually, and we really appreciate you taking the time with the materials, et cetera. And today, we get down to the funding and costs, which is really critical. So what are our priorities? And the funding and costs really lay that out. Just a reminder, this is a panel meeting. We had a public input session earlier in the week, and the public is welcome here. And we want to be as transparent as possible. I know I'm meeting with a whole group of providers later today, and we'll continue those. More than 1,000 people have had input so far, and our challenge is incorporating all of that and adapting the plan, which is already happening. So the conversation today and questions will be from panel members. This meeting will be posted on our website, and you can check out the OEC website, and the Blue Ribbon panel has a prominent spot there. And we hope and expect ongoing input as the work continues and is refined and changed. All of us on this call, and I believe probably everyone in the state, wants young children to get what they need and families to have what they need to thrive. And we're working on a plan to thrive, to make that happen. Okay, Jen, next slide. Thanks. This is just a look at our agenda today. We're going to have Simon Workman here from Prenatal to Five Strategies. He's been working with states around the country on finance. And I know I got to see him in Boston this year and was super impressed. And he's worked with some of the states that have made the most progress. So we wanted to bring in what they learned in those states. And he's going to talk to us for about 15 minutes. And then there'll be 10 or so minutes for questions from him. And then we're going to show some draft analyses and recommendations. And then we're going to have breakout discussions with panel members, and then we'll wrap up and do next steps. So Simon, I'm really happy to introduce you. You've done such great work in other states, and you've already been digging in Connecticut, helping us get our data and helping our data learn from what other states have learned as they've looked to build systems for children and families. So Simon, happy to turn it over to you. Thanks for taking time.
Thanks, Beth, and good morning, everyone. Great to be with you this morning. As Beth said, I'm Simon Workman, the co-founder and principal of Prenatal to Five Fiscal Strategies. If you go to the next slide, just brief, we are a national nonprofit that supports states and communities all around the country, as the commissioner said, with sort of everything to do with this P5 funding space. And so, the work that you are doing in this commission is really, in this panel, is really, aligned with where we are trying to help states and communities move, which is to really rethink how this system works and make sure it works actually, and how it doesn't work right now, right? And make sure it actually works for children and families and moving states forward. So what I'm going to do this morning is just take a few moments to talk about sort of this problem from a national perspective, and then sort of talk about some of the solutions that we have seen across the country to sort of consider as you are making progress on your recommendations. And as the Commissioner said, I've had the fortune to be able to work with the team that has been, supporting this work with you all over the last few months. And I'm excited about the progress you're making and about the places where the recommendations are going. So to the next slide, please. So like I said, I want to just start by talking about the problem. And, as I sort of think about the problem, this idea of a broken childcare market is really what I know a lot of you have been focused on over the last few months. But, as we look at what this market is, if we go to the next slide, this is a sort of graphical view of what the market can look like currently. That you have this market with all of these different types of programs. And, this is how it is in states across the country. I'm sure, you have all these different types of programs in Connecticut. But when you're a family looking for care for your children before they enter kindergarten, or even after kindergarten, right? Where after the school day, there are all these types of settings you might be in. Could be a family childcare home, could be a school-based pre-K program. It could be a childcare center that's for-profit, non-profit. It could be a Head Start center. You could have a nanny. There's all these different options, but there's not necessarily choice. There are lots of factors that impact whether families actually have a real choice across this whole market, with affordability being a really significant choice and sort of potential barrier to choosing these. So on the one hand, you look and say, this is great, families have all this choice, they can choose what works for them. But the reality is that for most families, you are really limited by the availability of care, whether it meets your needs from a time point of view, from a sort of, what you want for your child in terms of culture, in terms of, education, etc. Whether it, and even after all those choices, can you find a slot and can you afford it? The other piece is that from a provider point of view, each of these providers has access to different revenue sources, has access to those revenue sources that are tied to standards they have to meet or reporting requirements that they have to meet that sometimes align and sometimes don't. Sometimes they overlap, sometimes they're in conflict. And so that ends up with this really complex sort of system and funding stream. And if we go to the next slide, you can see there what this complex funding stream kind of looks like. So on the left-hand side, what you see is kind of this comes from a National Academies report that was done a few years ago. And it sort of gives this illustration of what the funding system kind of currently looks like. And, I know it's small and, I'm not going to go into detail on it other than to say the providers are there at the bottom of that graphic. And what you can see is there is a lot of complexity of those strings that are going down to the providers, right? And that is how the funding goes from those funding elements above it, family paying, the public sources and federal, state, local philanthropy. Yes, there's money, but all of that money to get from that place at the top there in the funnel down to the actual providers has this sort of patchwork, and that's what I was talking about before, of the different eligibility rules, funding parameters, reporting requirements, etc. And so the burden of managing all those funding streams is on the providers, right? And it's an extra stress, an extra issue on the providers or on the families to manage all of that. What you also see there is there's a big gap at the top, right? So even those funding streams that exist there in the green, orange, blue, and purple are not covering the full cost of actually how much it costs for care. And then, on the chart on the right, just kind of helps illustrate where the most of the money is coming from, which you can kind of see there on the left as well, that families are the primary payer of childcare. So when you look at the industry across, this is national data, and Connecticut is likely in line with this without sort of digging into the details, but about 60% of total industry receipts is families. So that kind of sets up this sort of interesting industry where you have what is arguably a public good in childcare, you have a lot of public money going into it, but families are the primary payer. And so unlike the K-12 system where, you know, government is the primary payer, families are the primary payer here, and they have a lot of different things that sort of impact their ability to pay. And on both sides of the house, both on that purple sort of government block and on the green on the families block, neither amount of revenue that a provider can get from that is sufficient to cover the cost of high quality care. And so we go to the next slide, you can kind of see why this is. You know, on the private pay side, in terms of families, yes, they're the biggest buyers of ECE, but they're very price sensitive. You know, families do want quality. They do look for, you know, what they define as quality. You know, you want to be making sure your child is being cared for in a place that you feel good about, but they also are limited in how much money they can literally afford to pay for it, right? So, you know, they value quality, but they can't necessarily afford it, which leads to this problem of sort of encouraging price competition, right? That's the traditional market, that you're encouraging price competition. But if you're encouraging price competition, there is a discouragement to suppliers, to the providers in this case, to actually invest in quality. Because if you invest in quality, you find that people cannot afford to pay for that quality. And if you can't afford to pay for quality, then if you can't get people to fill the spaces in your program, right, your program is not going to be financially sustainable. On the right-hand side, when you look at the government funding and how much money comes from public sources, the way that is determined right now in almost every state, bar 3, is states look at what is the private market paying, and they set a subsidy rate based on a level of that private market. So in theory, you know, you understand that makes sense. Well, if the market is this, the government is going to give low-income working families access to that market. But what it actually means in reality is that the government funding, the public funding, is replicating all of the failures of the private market, all of the inequities in the private market. So anywhere where there is a gap between what families can afford to pay and what care should really cost, that gets replicated in the subsidy system, which is why if you are in a sort of more low-income area, low-income neighborhood where the tuition that providers can charge is not very high, then the amount you receive in public subsidy is also not very high, right? And so you kind of, the programs that already can raise more revenue can get more revenue. The programs who can't raise revenue from families get even less. And you know, even within that, right, states don't necessarily set their rates at the highest level of the market rate. You know, Connecticut is actually pretty good on this, but you know, a lot of states are not actually funding even at the level of the market. So you have kind of on this both sides, a place where if you're a provider that says, I'm going to invest in quality, I'm going to put more money into this program, you then look and say, can I cover these costs somewhere? And in most cases, you can't. In most cases, you can't cover it by families. And in most cases, you can't cover it by the public funding. And, you know, you can really do some data analysis to understand what this gap looks like. So on the next slide, I have just kind of an example from a sort of hypothetical state. This is not Connecticut data, but just using it as an example of, you know, what this gap looks like and how this gap is different by age groups, right? So the younger the child is, the more expensive care is because of ratios and smaller group sizes, which is really important for developmental you know, high quality learning. But what it means is families don't necessarily have more money for an infant to be able, you know, when you have an infant, you have a lot of other expenses. So, you know, providers can't actually set their tuition rates as high as they need to be for the younger children. So when you do an analysis of what it truly costs for care, you see the gaps between what subsidy will pay or what tuition will pay and the true cost of care is bigger for younger children. So, you know, you see here, you know, every month there is a gap here of about $298 per infant in this analysis compared to $134 for a preschooler, which is why you start to see, you know, why we have lots of infant and toddler childcare deserts, right? And I know we're going to talk about that a little bit more about, why you see supply, responding to the demand more for preschoolers than you do for infants and toddlers. And so, this kind of goes to the fundamental of what is driving the cost of childcare, right? So on this next slide, I have a sort of summary of the analysis we do of childcare providers' budgets. And when you look at what it truly costs to provide quality childcare, the majority of the costs are on the personnel side, right? What you're paying in salaries and in benefits, but also the ratio and group size and the additional staff to know how many staff you have is taking up the majority of the cost of running a program, which means when you start thinking about innovations to make childcare more affordable, there is really very little room to cut costs in a childcare program, right? There is definitely things on the non-personnel side where there's some great initiatives out there around shared services and about trying to get economies of scale and networks, which can really help. But if 60 to 80% of the costs are on personnel, there is a huge connection between what you are paying teachers and the cost of care. And so if you pay teachers more, the cost of care goes up. The other way works as well. If you are limited in what you can receive in revenue, you're going to be limited in what you can pay your teachers. And so that's where we see this real clear link between this tension of families need affordable care, providers need to pay teachers more, and you get this tension where it's a real struggle to recruit teachers, and and still be having an affordable program. But if you're not an affordable program, you're not going to fill all the slots in your program, and if you can't fill the slots in your program, right, you can't keep operating, right? It's a real problem in this market. I also want to reflect just quickly on some of the terms over there on the right-hand side. So when we talk about price, at least from my perspective, we talk about it being what the market can bear and what families actually pay. So that's the tuition, it's the price that providers charge to families, which is based on the market, which is based on what they can actually, fill their program based on. The cost is actually what the program incurs in order to operate, right? So that would be, if you break that down by age, you actually understand what it actually costs for an infant, which in reality, what sort of providers do is they maybe charge a little less for infants than it actually costs, but a bit more for preschoolers to kind of even it out, right? Which is why if all the preschoolers go to public school, it gets really challenging for programs to have affordable infant and toddler care. A lot of programs have in-kind support, which helps reduce, fill that gap between price and cost. The one thing you'll hear me talk about a lot is true cost or cost of quality. This is reflecting what it should cost when you're not constrained by the available revenue, where most programs we talk to right now are making it work, but they're making it work by not paying their teachers enough, not offering benefits, by the director working 70 hours a week, by the director being in the classroom half the time, right? There are lots of things programs do to make this work, which adds a huge burden onto this predominantly female workforce. And so when we talk about cost modeling, we talk a lot about true cost to say, it's not enough just to talk about what it's currently costing. We have this underfunded system where we've been working in a scarcity mindset, and we should actually be true and honest about what it really takes to do this work. So let's talk a little bit about solutions. That was a somewhat dire picture that I just laid out, but there are things that are happening. And, if we go to the next slide, we have seen a growing recognition of the problem and a need for solutions. And I think if you click one more time, lots of things will pop up in a hopefully fun way. Yeah. So, over the last few years in particular, I've been working on this issue for many, many years. And, it used to be sort of a great thing when we got some headlines about childcare, right? And you're like, finally, people are paying attention to this thing that we've been working on for a while. The COVID pandemic certainly had an impact on that, and had an impact on the amount of attention that was paid to this problem, when suddenly even sort of middle and upper income families found that they couldn't find childcare, even if they could afford it, right? It definitely elevated the issue. When families were stuck home with their kids, they realized, maybe they realized a bit more the great things that childcare providers do every day. So there is a lot of things that that has been this growing recognition of the problem. Yes, we've seen lots of responses at the federal level to try and do something about this. But, we had a lot of COVID relief dollars, which has been great, but they are running out. What we are seeing now is states like Connecticut stepping up. And so there are lots of new commissions, panels, advisory boards. On this next slide here, I just pulled a few that you may have heard of. That National Academy study I mentioned from a few years ago really laid a lot of the groundwork for this, doing a transforming the financing of early care and education study that sort of helped to quantify what the cost of a better system would really look like. But across the country, from Connecticut, California, New York, Kansas, Virginia, Washington, and I'm sure there's many others, have started to say we need to pay more attention to this issue. And they range in breadth and depth of what they're focusing on, their level of focus. But key across all of these is a focus on data and information to better understand the system. As I was saying before, the sort of unique nature of this system, where it is largely a privately operated system, most of the programs operating, providing care are privately run, but there is a significant amount of public funding, and arguably it is a public good. But we have very little information about the system compared to sort of the K-12 system, where, because it's a public system, there's a lot of reporting requirements. It's sort of one system. It's a lot easier to sort of, navigate this data. We have this hugely disparate system in early childhood where, individual providers that may or may not take public funding, that you may or may not know things about, families who have very different needs that we know some about, but not fully about. And we know the information about the choices they make, but we don't know how much those choices are based on what they need versus what they can access in the system right now, which really means in order to understand the best levers to drive change, you need to really understand data. You need to understand, what the system needs. But then, from my lens, it's also about how much that system is going to cost and what revenue you have available or what revenue you need to achieve those goals. And, when you look at it, it's a big number, but you also then need to use the understanding of the data and where the gaps are largest to talk about what is your steps to get there, right? If you have a North Star, if you have a big goal that's going to cost more than you could kind of, raise in the next year, that's okay. We should be honest about that, but we can talk about what are the steps to get there. And so I want to share a little bit about some of the fiscal modeling that we do to help inform that decision making that a lot of these panels and task forces have used, and that we have done a lot of work around the country with. So on the next slide, I'm summarizing the sort of two ways that fiscal modeling is often used. Firstly, on the policy development side, if you do some fiscal modeling, which is really that understanding both at the program level of what is the gap between what a program can take in their revenue and what the true cost of care is, and how that's different by all the different variations of child age, program type, location, etc. The states can then use that data to ensure that subsidy rates are actually aligned with the true cost of care, and the differentiation is clear. If there's differentiation based on quality levels, what we call tiered reimbursement, or you're giving incentives to be at a higher quality, that the actual incentives or that reimbursement is sufficient to cover the higher cost that exists there. We see most states offer higher reimbursement for higher quality, but most states, it is not sufficient to cover the actual cost of higher quality. You can also use that modeling to help businesses. We know that a lot of early childhood providers are great caregivers, have got into this because they are, great teachers, great caregivers, but they're not necessarily business people. They don't necessarily have MBAs, right? And nor should they. So how are we supporting them as businesses? And so that the money that's going into them is really going to help support their business and operating this business in a sustainable way. You can also use that modeling for long-term fiscal planning. And this is where you get sort of out of the individual program basis into the more system-wide piece. And then, on advocacy, the model can be really used for advocacy, to understand what the big sort of inputs are needed. And across all of this, I think it's really key. We have to say, good data in equals good data out. So, when you are getting good data, it's going to make your models even more powerful. So I want to give two just very quick examples of how this has worked. Jen, if we could skip forward maybe to slide 15. I can just show you from New Mexico, which is one of the states that has used subsidy, sets their subsidy rates based on the cost of care. This had a significant impact on how much money got into providers' pockets. So on the left, what you see is the increasing rates in the subsidy rate in that public funding that providers got to serve children under the Child Care Development Fund. From the old approach of market rates to using the cost model, for infant rates went up 54%, toddler rates went up 83%, preschool rates went up 70%. So significant increase in the rates for those providers, and sort of highlighted where, yes, they were paying higher rates already for infants, but not sufficiently enough. On the right-hand table, what you see is the sort of underfunding amount. So this is kind of that, back to originally what that gap slide was, of the gap between the subsidy and the cost of care used to be 21% on average in centers, 38% in family childcare homes. Under the new model, they now got home-based providers up to the true cost of care, and centers are only just 6% underneath. And this goes to how they use data, right? They were limited in how much money they had, and they decided to make family childcare providers whole because they were the ones that were furthest behind before, right? So there was some remediation of inequities that existed in the system before. So then finally, on the last slide, I just want to show you how they also used it in New Mexico for long-term finance planning. So in addition to the sort of individual cost of care, they developed a 4-year finance plan and a 4-year finance plan model that sort of really looked at all of their different funding streams that was included in their department, which is childcare, pre-K, home visiting, and a few other things, as well as infrastructure and quality supports, and sort of estimated out what the cost would be over 4 years for those programs, including increases in salaries, including increases in eligibility, etc. And that's sort of that top table. But then they also looked at what's the revenue available to cover that, right? And then estimated what the gap was there, or if there was a gap. You might have heard New Mexico has some innovative new funding streams coming in, which has been great. And this helped to show how they were going to use that money. So show that it wasn't about this new money is coming in and it's not going to be able to be spent, because if you actually look at what you want for this system, it is clear that there is a huge need. And if you move away from the scarcity mindset into the actual, what do you want to do for this system? And if you have a data-informed model and you actually collect the data and understand, cost out each of those goals, you'll be in a place where you can really understand how is this goal achievable and what is the true amount of revenue you need to achieve that final goal. So that's just kind of a very sort of high level sort of overview of all these different places. Happy to take questions about all of this. I know there's a lot of complex data in there, but I think we do have a few minutes for questions.
Thank you so much, Simon. I see Jamie Eden has his hand up. Jamie.
Thanks, Beth. Hi, Simon. Thanks for the presentation. Fascinating. I'm just curious, any observations, whether that's from New Mexico or other states that have made progress here, in terms of, does that become a magnet for families from neighboring states to actually move in? And if so, what's the impact of that on the system? Does it add additional strain, or does it represent an additional opportunity for funding?
Yeah, I think that's a really interesting question, Jamie. I mean, I think, you know, in New Mexico, which has arguably done some of the most investments into this system, it's a little hard to sort of talk about moving in just because it's, you know, once you go out west, right, it's a much harder to do that. But I would say one of the things they are projecting in their numbers is reversing a decline in birth rates, reversing a decline in the population in the state, right? The state has been like 50th in a lot of child, you know, welfare numbers. And one of the things they kind of are doing with the whole suite of policies they're doing is saying they're hoping that's going to reverse that decline and encourage more families to, you know, have more kids. Because when you talk to families about why they stop at one child or two children, right, it's often about some of those costs, including childcare. I think up in the Northeast, where there is a bit more sort of fluidity of people moving around, I think, you know, in places like Maryland and DC, where they have universal preschool, you know, there is some sort of anecdotal evidence of people sort of making a decision that if you sort of lived across the border in Maryland and you now move into DC and you get free pre-K, you know, that saves you $20,000. I don't think I've seen great data on, you know, that, and I think it's hard to clearly say what is related to this policy versus other policies.
Yeah, thanks so much. That's a great question, Jamie. I know my daughter, it doesn't have kids yet, but lives in DC and basically says, I'm staying at least through preschool. So
right.
She's not moving to Maryland yet.
And part of the reason I asked the question is our focus is so problem oriented and so difficult that if there was an opportunity for us to highlight a tangible benefit for the state, maybe that would be helpful.
Yeah, I think so. Garrett, we have time for one more question, then we're going to move on, and there'll be time to have these discussions in the breakout groups, and we have Simon for the rest of the project. So as we get into work sessions, we'll have him too. So Garrett.
Thank you. I just wanted to hear what we can learn from states that have made the most progress on building data systems to tell them, you know, what's going on in their childcare systems.
Yeah, I mean, it's a big, complex issue, and there are I think, to me, where I've come out mostly is a lot of it's about related to governance, because a lot of it, there's a sort of like tech piece of like, can you build a data system that's going to do what you need to do, right? But there's also, can you get the data to go into that data system? Right. And a lot of that becomes like, where does that data exist right now? Who has authority over it? And do you have a sort of shared goal, vision across the government to say, yes, we're all going to work together to do this, right? I think the places that have been most successful around this either have a consolidated department or have great working relationships between different departments or have leadership from the highest level to say, you are going to work together, we are going to get past these barriers. Because if you have licensing sitting over here and quality rating over here and sort of demographers tracking family things there, getting them to talk to each other about this issue can be really challenging. And I think this is also where changing the mindset of childcare as a sort of work support only to a, you know, public good, a necessary thing that sort of everybody needs something, right? And sort of getting everybody on the same page is important.
Just to follow up quickly, are there examples of philanthropic engagement in that area? It seems like to me one of those areas where a market-funded, philanthropically funded catalyst. If you had, say, you had a governor who would lead on this, are there folks out there that have had that experience, or is that?
I know there's a few in like pockets of this that have been like focused on like data systems for, you know, family childcare providers, or for that are focused on the parent side. But I agree. I think it is a place that is rife for sort of more innovation in that area. I think the key is trying to make sure that you are balancing, you know, the flexibility that states need, right? Every state tells you their state is different and like they need something, versus, you know, saying the economies of scale of this is sort of having some data system that can be easily replicated in different states.
Thank you.
Thank you, Garrett. Okay. We're going to move on, and Simon, you'll be available in the work group. So Eloisa might have to bounce you between if issues come up in those.
And if people have questions they want to put in the chat, I'm here. So
oh, that's true. Yeah.
Well.
Questions in the chat. And just to stress, you know, I think one thing I want to stress is to bring the child at the center. When you say the current system disincentives quality, like that is like such a core issue we have to think about. Those are young children's brains when the brain is most vulnerable, where it impacts not just their education, but their future health, having a stable, reliable, high quality early childhood experience. So I thought that was particularly interesting. Jen, if you can get the presentation up, I'll do slide 5. These are just going to show you the goals of this particular work group, and we're going to go super quick. Okay, there we go. Thank you, Jen. Now I've got you all on my screen, so I can't see the slide, but now I can. These are the, we're just looking at the funding system to maximize the resources. That's the goal of this group. Next, Jen. And then these are the sort of 3 sub-goal areas, funding uses, maximizing current resources, and then the funding strategies, which you just heard some from Simon. There are different ways to fund the system. Okay, next slide. Okay, so these are sort of the funding and opportunity statements for this particular work group. We know that, and Simon just demonstrated, the funding levels are too low here and across the country. The strain on families to access high quality care that they can afford is a challenge. We have huge challenges with workforce in Connecticut. We're short 100,000 workers, and we know that childcare holds back tens of thousands of workers from entering the workforce, especially women. And then we just talked about the quality and what that impact is on the brain. And the quality is all about having highly qualified teachers. We all know teachers are what lead to high quality classrooms and high quality family childcare homes. So the high turnover makes it difficult. And then we know in Connecticut, our community colleges are down 60% in the early childhood education pipeline. So there are issues because of the current system. Next. And this is just sort of pointing out, like Simon showed, that other geographies have committed funding system changes that have led to more workforce participation. And Chris from CBIA and SVP and Mark and Jen and Monisha, we went out and talked to businesses last week, and Chris kept stressing this point that childcare could really help cut into that 100,000 job opening challenge Connecticut has. And many of you on the call are responsible for Connecticut being ahead of the curve in many ways, because we have a current state-funded system where state funds are paying for tens of thousands of children to have accredited high-quality early childhood care. It's still not enough, and you could see from the funnel that Simon had that, you know, families are still paying most of this, and families can only afford so much. So, but we do have a state system, which is a luxury compared to other states. So we have a strong foundation to build on. I'm going to turn it over to Mark now, Mark Argosh from SVP, who's been digging into the numbers. Mark.
Thank you, Commissioner. Next, we're going to examine some of the data that we do have. As you can see in this table, Connecticut has a robust mixed delivery system made up of a little over 3,500 providers, including childcare centers of different sizes, family childcare homes, and public schools. If we look at the next page, we have estimated what the total supply of childcare and preschool is in Connecticut based upon looking at the licensed capacity of programs throughout the state, plus the number of preschool students attending school-based programs. The licensed capacity is consistent with how other states are measuring their capacity, and also the viewpoints of early childhood providers. You can see here, we have somewhere in the area of around 113,000 slots currently available in Connecticut. Of course, these are statewide numbers. I'll also say this is somewhat different than what we've looked at in the past. We've historically looked at desired enrollment as a measure, but additional diligence has revealed that licensed capacity is a more accurate and a more meaningful measure in terms of really how the market is working. As I said, the school slots in this include both public school funded and state funded programs in schools. And we do not adjust, we're not able to adjust because we don't have the data between part-time and full day programs in the school slots. So as you can see, we end up with 93,000 slots in centers and family child care homes and about 21,000 slots in public schools. Please also note the low number, relatively low number here of infant and toddler seats relative to preschool seats. And that's important because the populations are fairly comparable, actually a little bit higher for the 0 to 3 infant toddlers, but our supply, our capacity of slots are significantly lower for infant toddlers. Why is all this important? For a couple of reasons. Understanding our supply of slots relative to demand can help inform the investments that we need to make in increasing capacity so that more children can receive care and more families are able to join the workforce. Second, the measure of supply here is a key element in estimating the cost of the early childhood education system, as Simon pointed out earlier. You know, if you look at the models, you're basically modeling the cost based upon the supply. And essentially the cost of the system in the simplest manner boils down to the number of slots times the cost per slot. If we look at the next page, we're going to compare demand versus supply for childcare and preschool. So preschool demand, we've estimated at 60, which is on the right, at 66% of the total population, which is in line with other geographies where preschool is highly affordable. It's also consistent with some measures through kids count data that have suggested that 61% of the state's 3 and 4-year-olds are going to preschool. And again, this is an area that our data could get better in. But in general, for preschool at a statewide level, our number of slots actually exceed our demand estimates. Even if we raised our percentages on demand at a statewide level, we would still have enough slots because we actually have enough slots for the entire population. Of course, there's a lot of variation across towns. And so we've also looked at an individual town level. This doesn't account, by the way, for regional, where people may be traveling from one town to another. But if we simply look at each individual town, there is a gap of about 1,740 slots for preschool. So that gives you kind of a rounded view of preschool. Now, obviously, the more important point on this page is the shortage of infant and toddler slots. We've estimated infant and toddler demand at roughly 50% of the population, reflecting that fact that some parents do prefer formal care less frequently for their youngest children. This is based upon survey data. The numbers were further adjusted down here, reflecting the fact that Connecticut has 12 weeks of paid parent leave. So the demand here in this chart is shown at 44%. And it's also based on looking at other geographies as well. So when you look at supply versus demand for infants and toddlers, you see a current gap on a statewide basis of 11,000 slots. And these are even with the 44% demand versus population kind of assumption. If you kind of did a bottoms up looking at each individual town, that 11,000 number actually is closer to 15,000 when you add up, because some towns actually have enough slots, but most of them, the vast majority of them do not. So another way of thinking about this is that today we have enough infant and toddler slots for only 33% of the population of infants and toddlers. So we need to grow our statewide capacity in order to meet demand. Speaking with parents and providers, this shortage has been confirmed. And the OEC's recent program to support expansion of contracted infant and toddler slots has been very successful. We hear from providers that those slots are snatched up as soon as they're offered. We know there is a shortage of significant amounts in infant and toddler. And what does that mean? As Simon said, what it means is parents are not working, who have children of that age. Now I'd like to turn back to the commissioner.
Thank you, Mark. I was looking at the questions in the chat, so I'm going to take over. I just want to stress that what we're going to do now is look at some potential incremental investments as we're going forward in the next stage to see what are the impacts and costs of improving compensation, access, and affordability. So there are a number of ways to look at this. There are different funding sources, and the state has a lot of different mechanisms now, which in other groups we've talked about simplifying. But these are like illustrative examples. When I think by the time we get to you all with recommendations, as we have more and more feedback, there'll be more sort of options to think about. But I think our core focus is, how do we both help families access childcare that's affordable, and how do we improve the quality of what exists by assuring that we have a workforce that's fairly compensated? And that I know from prior work groups, we've said compensation first. That's so important. The estimates will keep being changed, and we keep saying, the data is not perfect. Even as recently as yesterday, I know we made some adaptations because of outside questions and concerns. So this is all evolving. Okay, Jen, next slide. So go ahead, Mark.
Yeah, so this first slide kind of estimates the cost of increasing salaries and benefits for the entire system of centers and family child care homes. It excludes public schools, which generally pay at K-12 parity. So when Simon before talked about a cost model, we have in fact built a cost model for Connecticut that leverages the prior narrow cost analysis done by the University of Connecticut. And we've updated it for the total capacity of the system. So if we look at the total cost of the system, excluding schools, it's approximately 1.3 billion. This is this very complex market that Simon showed in one of his pictures. And if we were to address at a statewide level, the gap between what teachers are paid today versus kind of what would bring them to recommended levels that have been put together based upon benchmarks with the K-12 system, based upon similar credentials. What we would see here is a very significant cost, and we've broken it down to salaries, which would be an additional $443 million. And then we've broken down to benefits, which include both insurance and other benefits like retirement and such. And you can see the total cost of it for the whole system would add up to about $753 million, or about a 58% increase. You can see these numbers are strangely similar to New Mexico. And it's because, in fact, kind of, we have a fairly consistent approach right now across the country, as Simon indicated, that we currently, the system is kind of underfunded, and teachers are not being paid in a comparable way to what they would make if they were in public schools. So this is kind of the total cost of this. And when thinking about this, it's important to remember that this is for the system overall. the state today does not pay directly for the existing cost of staff for these programs, except for state-funded programs and indirectly through the subsidy payments through the Care for Kids program. So, when you think about, well, this is a big number, it's not like the state right now is paying for the core part, the existing salaries, either for those programs that are not state funded. So I just want to make that point clear. If we jump to the next page, we did the same analysis for the part of the system that the state does provide substantial funding for, the state funded programs, which is about 15% of the system. And we did the same kind of calculation, based upon those specific programs, what the cost would be of raising compensation levels, both salary and benefits, up to kind of comparable levels that you would expect, both in terms of salary benchmarks and on the benefits side, looking at the cost of health insurance in Connecticut, as well as looking at, even National Bureau of Labor Statistics benchmarks on other benefits for this category of employees. And the number is just under 100 million, 97 million. What that means is that on an annual basis, it would cost approximately 97 million per year in additional funding by the state in order to close the gap in workforce compensation for the state-funded programs. So that's kind of what this analysis shows. So in this, you could see between this and the prior page, we quantified what the workforce compensation gap is. It will need to be refined as we get better data on the credential levels of staff and the exact staffing for all these programs. We have pretty good data on the state-funded programs. We don't have great data on the current staffing for non-state funded programs. So we have modeled it based upon what we know are the number of seats in those programs.
Thanks, Mark. I'm going to take over now, and I'm going to go really quickly for folks just to try to maximize time in the work groups. And you all have this PowerPoint, and it'll be available on the website. So affordability is really an important goal too, and to the governor that families can afford this. And to Jamie's point, we want families to see Connecticut as family friendly and move here. So these are some costs right now. Connecticut families who make up to 60% of the state median income are eligible for a certificate to help pay for childcare. We estimated what it would cost to go to 70%. We also know the feds are moving toward a copay of 7%, which is different than 10%. That would cost the state $3.5 million about. And then a recommendation from a panel member was we need to look at presumptive eligibility to make access easier for families and help workforce. And that costs $11 million for 3 months. The panel could think about 2 months or 1 month, but that would require an improved data system. And then we have a lot of applications rejected, and our system could be improved, our technology system improved, and maybe our support to applicants improved. And we think we could get a 10% increase in families who are then deemed eligible, and that's about 19 million. And finally, we've looked at something called TriShare. I think we've talked about it a couple times with panel members, but just to pilot a situation where the state puts up money, businesses put up money, and parents put up money, and you pilot this maybe in a region that has high childcare needs. And this is called TriShare. So the parent would pay a third, the business would pay a third, and the state would pay a third for the childcare under that model. Next. So there are also other ways to increase access. We know that state-funded spaces, 60% are reserved for families who meet income thresholds below 75% of the state median income, but 40% of those spaces can be used for families who are above that threshold, who maybe just miss out on being eligible for Care for Kids. So if we increased infant toddler spaces, as we've shown, that's a huge problem. which the Governor Lamont just increased by 1,300 spaces. If that was doubled and added 2,600 more infant toddler spaces, the incremental cost of that is $50 million a year. There's also a program called Smart Start, which is a small program in the state that pairs the state of Connecticut funds with public school funds. So locals put in funding, and in communities, we pay about $5,000 a space from the state. What we're finding, this program started about 10 years ago, and we did a look at the data and found that districts are using this as a way to enroll preschool children with special education needs in a school day, school year model. Most public school, preschool, special education classrooms are part week, part day. And one thing we heard in our equity and access group was that parents of children with special needs are really struggling to get back in the workforce because of the way the public schools structure their preschool special education. And then as we were doing research here, we discovered that Smart Start was a way maybe to help with that access issue. And you could serve an additional 1,900 students and expand that access to children with special needs with more of a school day, school year model instead of a part day, part week model. Next slide. So I think we had the first panel meeting around the investment that there's just no better investment that we can make as a society to have an economic impact in our community and also, on children. I keep coming back to bringing children back to the center there. So I think the Funding and Costs Work Group thinks that we need to make a commitment, and this will be over years. This isn't like going to change in a day. It's going to take a number of years to make a lot of these changes, but that we need to commit to equitably funding an accessible, affordable, high quality early childhood system for Connecticut families. Jen, is there one more slide or was that it? One more. Okay. So these are the areas that we want to commit to adequately and equitably funding. I think you've heard us say again and again, compensation first, that we need to support professional compensation and benefits. We can control the state funded programs. We can't totally control the private market. And we're going to have to think about how we support other childcare workers who aren't in the state funded system, because across the state, this is an issue. We need to increase affordability for families. We need to increase access, and I think really stay focused on that infant and toddler problem and children with special needs. And we need, to Garrett's point, we need improved systems. And maybe I think Garrett was saying, maybe there's some partnerships we can have with philanthropy and the state to think about how to do that well. Okay. The other recommendations around maximizing the state, local, and federal funds. Part of this is to have our system match up with what families need and supply and demand, and manage enrollment better. We really need to, we have this blue ribbon panel for now, like to really dig in and do in 10 months what a lot of states do in 3 years. But then we have an early childhood cabinet. How do we keep this work moving forward with the early childhood cabinet? And think about the cabinet has representatives from all different agencies. So thinking about how can this intersect with Department of Social Services, with Department of Education. Also, leveraging Head Start partnerships. We do find that programs in the state that have a Head Start component, they really are good to build on, because they have a lot of supports from the federal government. They have more of a parent engagement focus, and they also have very often case management to really help families throughout their whole lives, and we can both learn from them and then also use state dollars to enhance them. So their part day programs use state dollars to extend the day to help families with childcare, but leveraging those federal dollars. We also, I feel like, Commissioner Russell Tucker and I have a great relationship, but we could partner even more and think about how to leverage some of the federal education dollars. Other states leverage Title I and IDEA Part B, which are those special ed preschool dollars is what Part B is. And then we really need, coming back to the data systems and Simon's point, we need a way from the local community to the region to the state. We need a way to understand what the community needs are and to build a system that responds to community needs. This process has taught me more than ever. I always knew the state was different, but when you dig in town by town at who needs what, it's really different in every town. And so we need to build a responsive governance system and a state system and regional system that is responsive to local needs. Next slide. And then, so what are the strategies? We need to convene state leaders and think about over time, how do we incrementally increase ECE funding sources and mechanisms, looking at how other states have done this and building on, the work Governor Lamont has started. I mean, we have about 25% more families on Care for Kids. We've doubled the number of state-funded infant toddler spaces over the past few years. But how do you do that? And partnering, CBIA has already been a great partner, bringing businesses to the table to identify how to engage businesses and how they can be part of the problem solving and part of the solution. It was really, the other item is, last session, there was an early childhood education fund that was developed in legislation and sits at the Office of the State Comptroller. This blue ribbon panel has actually been asked in legislation to weigh in on how to use such a fund. And other states have had a fund like this to sort of say, we have this special fund with a special set of revenues just for early childhood. So Connecticut has that part set up already, and we'll have to weigh in on that. And then think about the role of philanthropy. We have made great strides in Connecticut in early childhood, in really great part due to philanthropy. Even school readiness in the 90s, that was really pushed by philanthropic organizations and business leaders. So we know we need everyone at the table. Okay. Now we made it. Now we're going to move on to breakout groups and sort of have a conversation and talk through some of this and get your reactions, and we'll be taking notes. We find that this is a better way for the panel to sort of just chat and we can find out what's on your mind. We know we've put a lot forward, and we will now go to questions.
Commissioner,
Oh, I am
Dr.
wrong.
Manette Ferguson has her hand up.
Sure. This is actually a pause for Q&A, I guess. We're not to the breakout yet. Soon. Okay, Monette, sorry.
That's okay. Good morning. Just had a few thoughts that I just wanted to raise before we went into our breakout sessions. I wanted to continue to raise equity as part of this conversation. We always talk equal. We want everybody to have the same things, but we know that equity is not equal. And we have communities of color and communities that have been really left out, rural and urban, of some of the opportunities in the state. And we really want to think about how we get those communities to a level of access as well. So that was one point that I wanted to make. Another point, I see SDE keeps coming up, but DSS requires all community action agencies, which cover the entire state, to have community needs assessments as well as plans every year and updates. So it is important that we dig into existing data. I keep hearing this data gap,
Yeah.
And I know as a community action director, every year, in addition to Head Start, federally funded Head Start programs also have to have community action plans and community needs assessments. So, and that's done through a research-based process. There's no shorts on this, right? So we actually literally have to go out to the community we serve, ask questions, and then analyze and look at that data, and then reconstruct and think about programming as it relates to assisting families to get to evolve out of poverty. So think about community action agencies when you think about some of those gaps in data. Think about Department of Social Services when you think about funds and access and them understanding communities. Also think about Department of Children and Families. There is an intervention. It doesn't mean child welfare does not mean that children are being taken because of abuse and neglect. There is an intervention piece with DCF that avoids all of that and helps to uplift families before they get to the impact of child welfare that can be detrimental or harmful to families. And they have funds that can help with childcare and things and development and things like that. We need to lean into DCF a little. I know it might sound a little scary and people think DCF and child welfare as negative, but I think this is an opportunity for us to think differently with other state agencies to bring some dollars to the table to assist with this huge issue we have with funding. Love SDE to death, please don't get me wrong, but I think there are some other state agencies that have dollars, if we think about it differently, that have dollars that maybe be able to tap into in order to fill some of these gaps.
Yeah, I think you make a really good point, Dr. Ferguson. I think we have to look at the Family First initiative at DCF where dollars can be available for prevention. Really, really good point.
I got lots of other points, but I'll share them in
my
group.
Go.
I just wanted to uplift a couple of things before it got lost in the sauce. Thank you.
Sure, got it. Billy.
So
Say Dr. Johnson, I'm so sorry. Dr. Ferguson, Dr. Johnson, I blew it.
one of the questions was deprioritize and prioritize. So one thing I'm thinking about when I saw the recommendations, and it probably was last meeting, but it filtered into this meeting, is, I mean, the priority should be to get funds out the door, not create more governmental structures that suck up funds.
Mm-hmm.
I want to lift that.
Yeah.
I think Dr. Ferguson, you know, I'm a pre-K-12 person. I strongly agree that there are many other partners we should start with before SDE. And the only reason I say that is ECS has been going on pre-K to 12 for a very long time. They haven't solved their funding inequity. So I'm not sure how, you know, rolling into an inequitable system, right, would help us build an equitable system. So that's just a theoretical thought. And the other thing is just thinking about how funding can be used differently. And are we, and when we talk about licensure and we talk about groups having access to funding, the thing that kind of comes up for me around the funding is licensure about control or is it about getting funding out the door? And there's really a mindset around that I'm just kind of wondering where we are on that.
Yeah.
So I just want to lift those. There's more, but I know we're going to go to our groups to talk about that, but I do want to lift those.
Yeah, I appreciate that. And I do think, like, from our standpoint, we're looking at early childhood as its own sector. Just to put that out there, that's why we have an Office of Early Childhood. In a lot of states, we're just they're just in the Department of Education. But I think these are really, I just want to say that as for the group to understand, but I think that's really important. We're going to do one more question here and then go to breakouts. Jessica.
Thank you so much. I'll be brief and it's a comment. I would just love for us all, as we think about prioritization and deprioritization, it's easy to look at the costs of dollars spent on childcare. It's less easy to keep in mind the costs of not providing childcare. Yep. I think you've done a great job, Beth and Simon, you as well, of lifting these up, but to actually be balancing a ledger in our head against what children are not getting, what that will cost later on, against parents' ability to enter the workforce. And so those invisible costs need to weigh in our prioritizations as well.
Yes, Jessica, I think what I'll do based on that comment is put in the chat something about that for the panel from the Center for the Developing Child about the costs, the long-term costs of not investing. So I'll put that in the chat for everyone, and I really appreciate you raising that up. Okay, we really are now going to breakout groups. Jen, you kept us rolling along, and I went back to the questions. we're going into 2 breakout groups. And there'll be some questions. I'm going to facilitate one, and Elena Trueworthy, our Deputy Commissioner, will be facilitating the other. So we're gonna, and we'll get to the reflections in there. Let's just get in the groups, get people talking. Okay.
Great.
Eloisa.
All right. So the first group will just stay in here and there'll be one that goes out. So 2 groups, but I will do that right now. It's always interesting to watch how the screen changes.
Can someone from OEC, maybe Jill, you can do this for me. I put in the chat the Center for the Developing Child for our all staff to read that came out yesterday, or that I was reading yesterday. Do you mind putting that in the meeting chat?
Yep, I got it.
Okay. We just want to start with general reactions. I think Monette and Billy and Jessica started us off on a really good foot for, all right, people, keep your priorities straight, and panel members are expressing their priorities. And so that's really important for us. So other panel members, these breakout groups are open to the public, but they're supposed to prioritize panel member comments and questions. And if they, if you look at and you say, this was really missing, why this strategy and not that strategy? As I said, the examples we put out there were meant to be illustrative. They're definitely not. There are probably 15 potential investments for the funding and cost work group. Just wanted to show you the cost of a lot of them because they're not small costs. And, we have a complex state budget with a spending cap, et cetera. So there are a lot of considerations, but wanted to get it started. So just raise your hand or talk if you're on.
Beth, I was just wanting to know, would it be helpful for us to look at school lunch data, because those represent families, not just the children enrolled in the school, and they also have income, and just to understand communities better when it comes to cost of care. I'm wondering, and maybe I'm totally off base with that, but I'm wondering if there are elements of school lunch data that could be helpful when we think about cost and need and communities and families and how they're kind of comprised. Just a thought.
Yeah, I was just in a meeting yesterday with the governor and Commissioner Russell Tucker, and we were talking about the data dashboard they have at SDE. And like, for example, we can look at the number of children who don't have housing across the state. Like that would be a really good indicator of communities that have a lot of families that are struggling to make ends meet. I also think, as you said that, on the education committee, now it gets a little complicated because so many communities are 100% free and reduced lunch. But Senator McCrory might remember this. I think Representative Fleischman used to always say we should be looking at Medicaid and Husky because it's just data we have readily available as an indicator of community need. So we've been using SVI, which is 10 factor, so it's a little more than Medicaid. But I will say that when you put up SVI around the gaps, it doesn't always work with where the childcare deserts are and SVI. That's why when we did some funding, we put both things together. We combined SVI plus desert. But I think you're right. We need to really decide. The panel's going to have to make recommendations about prioritizing based on high need communities, and we have to look for the best data point. So we'll stay on that. But that's the point you're making, is let's find the right. What we have a lot of data. It might not be at SDE or OEC, but we've got good data about communities with needs. So I think you make a really important.
Beth had a question.
Yeah. This Senator McCrory.
You were mentioning about rejections, families being rejected from programs or services. Why are there so many rejections? Because basically, a lot of this is based on age of the child in need. Why are there so many rejections, and where are those rejections coming from mostly? That's just a two-part question, because I'm learning about this house.
And I'll ask the note takers to take a note, and we can get you like really specific data. But from talking to the folks in my office, it's that parents don't follow through on the paperwork. It's that parents aren't working the hours they're using care, some of the rules around that. And just sometimes just, $10 above the income threshold, all those kinds of
Okay.
things weigh in. But we think if we could improve the technology, at least those that are like maybe forgetting a pay stub, they would get a text that would just say, remember, instead of the programs having to follow up with 100 families.
So it sounds like we need a little more hand holding in some communities than others to follow up
Yes.
and make sure our parents, and that needs to happen. That can happen if it is done appropriately, competently. The other part, you said something about working the hours. And again, this is not my wheelhouse. We have traditional work hours, 8 to 5, whatever, but some parents work second shift, some work third shift.
Yep.
Is that an issue? If that is an issue, which is going to be a huge issue for working class families, how do we get around the fact that, I need care from the time of 4 in the afternoon to 12 o'clock? And how does that play into what we're doing here?
Yeah, I think we need to address that. It's a big problem in Connecticut for people that are working around the clock. There are childcare gaps for sure. What has to happen with Care for Kids is the hours the parents are working need to match up with the hours they have care. So that might get in the way of Care for Kids paying, if a parent is working third shift and the parent wants to send them to a morning preschool, they might not get, most parents use full-time childcare, but I'm just saying that, so it's complicated. So we're going to look at reducing that rejection rate and all the variables, but we'll get you the details on rejection rates. Okay, Garrett.
Yeah, I'm wondering if we have the ability to compare outcomes from our childcare system versus the compensation for the staff in those centers. And I mean, I assume that a given center is going to have that on average, lower paid folks are less qualified and probably have less outcomes, but I know that really good management makes up for a lot of sins. So I'm wondering if there are proof points. The reason I'm asking is I'm just thinking about a typical voter saying, well, there are a ton of people working for low wages, so the system's not broke, don't fix it in that across that metric. And that may be a bad conclusion, and we might be able to show that.
Yeah, I appreciate this question. We don't have an answer to that, but we hope to. We have a couple of studies that are kicking off now, funded by Senator Fanfara, to try to get at this in a randomized control way. But I will say, in my graduate work, I worked on the 3-state study, which was a comprehensive NICHD study of childcare. And when they put all the variables and all the information into a step regression, I hope I'm saying the right words because it was a long time ago, but basically you put it into the pot and you say, what comes out as the most important feature to child outcomes based on the center variables? And it was wild. It was in the Wall Street Journal. It was teacher pay, which, gets at a lot of things. Programs that pay their teachers better often have more supports like free rents, but that the pay and quality of those teachers is likely a very important factor in outcomes for children. But it was just amazing that of all the things we measured, why would it be teacher pay? It wasn't teacher degree, it was teacher pay. So it was likely programs that had financial supports to be able to support better wages, could support other things.
We must have anecdotal evidence in the state of that, right? We know which places are really doing
absolutely. You can walk in and know. I mean, we know.
So we don't nowhere in the reading that I've done so far, and maybe I missed it, do we make that argument, which is pretty fundamental.
Yeah.
It's not just a question it's not just a question of fairness and supply and demand. It's a question of, would you want your child in the center, and what are the outcomes going to be?
Right. That's a good point. And we haven't made the point about, we're talking about compensation because it's an equity issue for early childhood providers.
Right.
But it's a quality issue that the pay impacts who comes into the field and how they're trained and what the background is. So it's a complicated morass. We have some incredible teachers who are way underpaid, who don't have degrees too. It's not always, but if you look at the population, we're looking for ways with the in the workforce. You saw we're talking about the unifying framework. That is a way to try to make sure we don't lose the teachers doing the work now as we move toward standards for the teachers. Kit, you might have something to say about this. I should probably say Dr. Valencia Day too.
No doctor yet. But thank you and good morning to everyone. So bear with me. I probably in my simplistic train of thought here. So I like the presentation of Simon because I was able to see it visually. Okay. But it frustrates me because Commissioner Bye, for many years I've been pushing for infant toddler spaces.
Yeah,
that has been
that's
my
the thing. Yeah.
So I guess my question is, and maybe this is the question that we're trying to solve, is that we know that there is a gap in funding. Okay, so where will we, even if we come up with a plan, okay, such as the subsidy rate to be aligned with the true cost of care, the state of Connecticut have the money? Because we could recommend all this funding. So we could say all this funding, care for kids, school readiness, whatever else funding goes into one funnel. But do we have that? Because there was a slide that says that it will cost us X number of million of dollars, the state itself. So where will that come from?
Well,
it's sort of like another problem that, that we're looking at. So to put something in one area, we take out something from another area. So that's one. And then two, in all the meetings, I think I've said this, we need to also collaborate and coordinate, leverage with the Connecticut state system of colleges. And, we've changed our title. So I think it's Connecticut State Colleges and Universities, or the Connecticut State Community Colleges, not just SDE, because who goes into the STC, the 4-year, comes from the community colleges. So we also need to start from that. But I guess my main focus is that I just feel like it's all a domino effect. But then I'm looking at where will we get the money?
Yeah.
Will the governor sign off and say it's 1 point something billion that we need to put in childcare? So that's just my thought of how are we going to do it?
Yep, those are some important questions. And I think, having Simon on, I think it's important to say, New Mexico had a plan before they had the funds. We need a plan and we need priorities. What are the priorities if there is funding, and the priorities around equity? We can't fix everything all at once. So we've got to start in the highest need areas. And to your point, that's infant toddler, and those are in communities with high needs where there's less access. But it doesn't mean we don't have to look at the whole system and what are the parts that are broken. So we don't know exactly what will be available financially. We do know, though, for example, for the next 3 years, there's an 11% increase in care for kids rates. To other states, that would be an incredible starting point. So we have that as a starting point. And then incrementally, we work from there. We know that infant toddler rates just went up 58% a year ago, and that's going to continue. We know that in next year's budget, school readiness rates go up 10%. So there are some things in motion to build on, but your question's a good one. And in terms of the state colleges and universities, absolutely have to be partners. And, you're seeing the decline in early childhood workers yourself live time, yet you and I are at an event in New Haven where there are all these early childhood providers who are making way less than they deserve out at night trying to get better. Like it's not fair to ask these women to keep doing this for less than they deserve. So I think that's it. That's why the focus has been on compensation first. We've heard that loud and clear, and hopefully the panel can feel that as we hear that, we are digging in deeper there. And that's why those recommendations were in there today, or those, I should say those, they weren't really, those calculations were there so the panel could see this is what it would cost to get there. And we have to remember this is over 5 years. We've asked for a 5-year plan. Even if the governor put $200 million in the budget next year, which I'm not saying is going to happen, we could not get that many spaces out. We could not have local governance set up. We could not have the system in place. So we need to focus on the system and the funds needed over time. It's all got to be staged. Simon, I don't know if you want to add in on that with what's happening.
You say exactly what I was saying. I mean, I think the big number that comes out of sort of when you say what do we really need is huge. And like, if it's $1 billion, that shuts the door too often because we were just like, that's not possible. So I think, having that phased approach where you say, the first 200 million, this is our biggest priority, informed by data where the gaps are biggest, where the inequities are biggest. But if you only talk about that 200 million, then when you get 200 million, everyone's like, done, we fixed this problem, right? We increased rates 58%, and that's why we push really to be clear on like, put that big number out there. Know that it's not going to happen in 1 year. Know it's like a 5 or more year like plan to get there. And then you start sort of filling in those gaps. And there's a whole campaign that has to happen to sort of look at where that money comes from. So yes, it's a big number. Yes, you might not have the lens into it right now, but I implore you not to be sort of constrained by the sort of current what feels possible and sort of, well, like, not to be Pollyannish, but like to be like, look, this is, make the case. This is how much it costs. We have to do it. If we don't do it, this is the implications, right? To some of the other conversations.
Is there anything else? I know, Eloisa, you're going to tell us we have to go back soon, but I don't, there might be someone sitting on these time just goes too fast.
Bye, this is John personally at SDE. I just put in the chat the link to EdSite. And so for folks who are looking at free and reduced data, you can look up any school in the state, the performance data there. There's Connecticut report cards, all of the information is publicly available. You can even compare one school or one community to the entire state. So folks should check that out. And then we can certainly have an opportunity, Commissioner, to have one of our staff come and brief the committee on accessing EdSite and looking at some of the data.
That'll be awesome. That'd be great. And then committee members could look. That'd be great. Thank you, John.
Commissioner, too, I just want to add that we've gotten some really good questions, respectful questions from non-panel members in the chat, and we are noting those, and we will try to include answers to those in the meeting minutes and follow-up so that you will get responses to those questions. Thank you.
Yep. That's great. That's great. So yeah, we're talking really big picture over time and being ready. Because I also really believe the federal government, once they can get their act together and really put together a budget instead of fight, that childcare is high on people's lists. So I think we can keep that in mind too.
Beth, can I also ask us to consider the utilization of Care for Kids? The last I checked, some data, I'm not sure where I saw it, was 7% for the state. And there's a reason for that low utilization. And I'd like for us to dig into the rules, the federal rules, and also the state rules around Care for Kids and try to find out why that utilization is so low. And I know some of it is probably common sense. We know why. I know in my community, we have a large immigrant population that does not qualify for Care for Kids. And I know that that probably resonates across the state, but there may be other reasons and rules that can be changed. And I think that was brought up in one of the slides today that maybe we could dig into some of the barriers to Care for Kids. I'd also like to think about a campaign to increase utilization of Care for Kids. If in fact those rules can be changed, can we add a recommendation to have a robust campaign around increased utilization across the state if the rules are more attractive to families
and to providers.
And to providers, of course.
Not having presumptive eligibility makes it hard for families to get a spot. And that makes it hard for providers to take families.
And also looking at some of the state funded programs like Husky, when we think about presumptive eligibility and things of that nature, there are rules and programs in place that we do not have to recreate the wheel. There are things already happening that really uplift families that really need these programs, and the rules have been changed already where we don't have to start from scratch. And I think that's something that we really need to look into are these processes and these situations that already exist that OEC could just tag into and kind of keep it moving. Because time is of essence.
Yeah, I think we should just have like Team OEC dig in there and see what can we just make easier. We do have to keep the undocumented population in mind as well, who can't access care for kids, which is why I know other states have built the whole system on their subsidy system. I think it's got to be a combination of state funded and subsidy, or else we really miss out on those families. And the families making just above 75% of SMI, or even if we move to 100%, there are always families who need access, and state-funded programs really provide access to all. And it's sort of a stable funding source for programs, whereas Care for Kids, in and out 1 month, it's a little less reliable. So I think that's why you saw us have recommendations around both. But if you're working overnight shift, you need Care for Kids. Like you can't.
Exactly. And there's always this gap and this ebb and flow between what the state says we could do and what the feds say we could do. And a lot of times the state is a lot more rigid than what the feds say.
Totally.
And we could break down those barriers very easily by just kind of going with the flow and making things easier for providers as well as families. So I think that I would seriously consider as we're putting forth recommendations, to really think about kind of realigning those state and federal rules to really make things easier and break down barriers for providers and families when it comes to Care for Kids.
Definitely. Thank you for that. It's actually the perfect thing to end on, because, we're talking about how do you afford all this? What do you do? There's some things we can just do. Let's just do them and make those first, right? And then have a long-term plan, because for the funding and the data to work together and be successful is just going to take some time. So we are out of time, I'm afraid. I just I know, Audette, you didn't have a chance to speak. So if people don't mind, like just a couple minutes, because we have not heard from the after school perspective. So you may have something to add in that's different, Audette, before we say goodbye.
Mute.
Hi there.
Hi.
So I just wanted to continue with the discussion about parents and having more parents be eligible for Care for Kids. But it raised a question immediately in my mind about are there enough providers that are offering Care for Kids as an option to families? And I think it takes both advocacy for families to enroll, but also for centers to participate more fully.
Yes,
and that was just a comment.
It's a really good point. Well, panel members might not be aware. There are just a lot of programs that say, I won't take Care for Kids. It's too much of a pain in the butt. So to Monette's point, like making it easier, making it pay better, faster. There are a lot of reasons why parents don't participate and programs don't participate. So I think we're hearing loud and clear here today. Let's dig into that from panel members and figure out how to make that system work better. And there's some federal rules coming down that are actually going to make us. But Connecticut, starting with after welfare reform, had some of the most restrictive Care for Kids rules. We've chipped away at some of them, but we could do much better. So I think that's a really, really important point. So I really appreciate the thoughts and feedback. We're going to be, we took detailed notes. We'll send you not just summaries from here, but we've actually got summaries from every panel, sort of homework session or educational sessions. We have feedback from the public and from other public meetings on those topics. Panel members are going to get a summary of that. And that's coming in the next 2 weeks. And we also have a panel comment form for you to send us additional comments if you have those. I'm going to ask Eloisa to put that in the chat if she hasn't already. You can also reach out to us directly, ask for a meeting directly if you have specific questions, or if you say you've got to talk to this person because they really know their stuff and can really be helpful. We're doing that as much as we possibly can. This is a, an open collaborative process, and I've been watching the plan change before my very eyes because of your feedback. And we are thinking differently because not everyone here, I've been a provider for 40 years, but there are a lot of minds of people who aren't providers. And I think the multiple perspectives are really helping me sort of think complexly. And we haven't heard a lot from parents today. And so we're going to continue to seek ways to bring parent voices in even more and bring panel members those as well. So I hope you all have a great day. We're getting close to the weekend, and it's our most beautiful time of year. So go to the beach, go to the mountains, go out in your yard or your neighborhood, get some ice cream. Great to see you all. Bye-bye.